The video for the 60-year-old male with diabetes and presents to the clinic with back pain. Important history questions that I would be asking is, first we need to determine if these are joint symptoms or are they muscular symptoms. So we need to start by doing a good history on this patient. When did the pain start? What were you doing when the pain started? Can you describe this pain to me? Is it sharp? Is it dull? Is it burning? Is it aching? Is it deep? Is it stabbing? Or is there certain times of the day that this pain is worse? Is it worse when you wake up in the morning? Is the pain waking you up from sleep? Is the pain better after you've gotten up and moved around a little bit? Is there any swelling or redness or any change in your movements or restrictions of your activities of daily living? When you had this pain come on, did you hear anything? A snap, a click, a pop? Did you feel anything? A tear? Or any numbness or tingling or locking or snapping? What medications have you tried to relieve the pain with over-the-counter medications? Did they help? Did you try anything else to help alleviate the pain? Ice, rest, stretching, did any of those help alleviate the pain? We need to get a past medical history. Have you had any traumas to your back previously? Do you have a history of back problems? Have you had any back surgeries? Do you have any chronic illnesses like arthritis or osteoporosis or any skeletal deformities? What about family history? We need to know, does you have a family history of scoliosis, arthritis, rheumatoid arthritis, osteoarthritis, or gout? Some of the key physical exams on this: first, we're going to have to do an inspection. We're going to look at anterior, posterior, and lateral aspects of the patient's posture. Then we're going to do some palpation. We're going to palpate the spine for tenderness. We're going to note any heat or swelling on the spine. We need to evaluate the range of motion of the cervical spine. We can do flexion, extension, left and right, chin down, head back. Evaluate the range of motion of the thoracic and lumbar spine. Have the patient bend over, touch their toes. Have them bend at the waist at the back and hyperextend their back. Note any lordosis or any kyphosis. Have the patient bend side to side, letting us know if there's any pain, numbness, or tingling while they're doing any of these range of motions, or limited range of motion while doing them. We need to do a lower spine assessment, a straight leg raising test. This is a nerve root test, looking for irritation of the nerve root or the lumbar disc herniation at L4, L5, and S1. We can also do a femoral stretch test, and this will detect inflammation of the nerve root of L1, L2, and L3. Any increased pain, any increased numbness or tingling, or just new pain while doing these tests would be red flags for this patient. Furthermore, doing a neurovascular assessment on this patient, looking at the color of the extremities. Are they pallor? These cyanotic? These will all be issues that you'd want to send this patient to the emergency room immediately. Temperature: are the extremities cool or cold? Cap refill on his toes is greater than 4 seconds. Swelling: any significant or swollen areas, significantly swollen areas. Pain: anything that is moderate to severe pain that can't be controlled. Sensation loss, numbness, tingling, pins and needles sensation. When it comes to movement, any severe or moderately decreased range of motion or complete lack of range of motion in that area would be grounds for a ER visit. And then also any loss of bowel or bladder with the pain, when the pain happened, or while doing any of these tests would be a reason for an emergency room visit. Thank you.